Hi, everyone. We're really sorry we are not able to be here live tonight. My name is Camila de la Vega, and this is my group, Isabel Mejia and Mayra Hoyos. We worked on a project on learning more about sexual and reproductive health for women minors in Colombia. So what is the challenge we're trying to address? First, we wanted to make sure we make clear that gender-based violence is prevalent in the areas dominated by extractive industries, especially mining. So the women in these regions in Colombia are experiencing more gender-based violence than women in other parts of Colombia. So DLAB and the Alliance for Responsible Mining are responding by leading a movement building initiative in the area. This is a 22-month process, and they did an initial round of data collection a couple times, actually. So we're just adding and building on the work that has been done previously. On one of our initial talks on Zoom through one of the women miners, we were able to hear her concern because we were talking about sexual and reproductive health and the availability of classes and how people learn about this. And she was talking about her daughter and how her daughter is 14 and she still hasn't learned anything about this topic, and she herself doesn't have those conversations with her daughter. So she was saying, I don't know how to begin to talk about sexual and reproductive health. A class would be of great help. So previous work that has been done on this has been mainly by students at the D-Lab. They did a needs assessment in 2019, and they found that women minors are often exploited by middlemen. And the second project that was done is a gender analysis that was conducted in 2020, and this provided substantial evidence of gender-based violence, especially economic gender-based violence in the area. So again, we are building on this work, and we are going into depth into specifically what is happening with sexual and reproductive health.
Thank you, Cami. We also wanted to talk and address which are some of the partners for this project. So the main partners for this project are MIT, the D-Lab, and also we're working with a local university in Cali, Colombia, which is called Universidad ICESI. We're also working with the municipality, and that's the name of our main point of contact, Angie Pamela Cuero, and also Maria Fernanda Escobar. And we're partnering also with local doctors to address many of the issues that women have raised previously in this needs assessment and that were found that were relevant in the gender analysis that was previously done. So as the third part of this work, that is the ongoing work between the D-Lab and the Alliance for Responsible Mining in Colombia, we are working currently on collecting data on which are the conditions of the women miners and which are some of the main threats that they're facing. So as the first part of this process, we conducted some focus groups. These focus groups were conducted during November 11, 2021. And in this group, 16 women miners participated. They were from the municipality of Zaragoza. And we had two groups. The first group consisted of women 18 to 30 years old, and the second group of women 30 to 50 years old. And finally, some of the topics that were covered through this focus group methodology were questions on sex education, on sexual and reproductive rights, on contraceptive methods, and on maternal health.
So some of the learnings and conclusions we got out of the conversation with these women were mainly that these women from this community do not know their sexual and reproductive rights. They don't usually support or practice abortion. And inside the community, there is not a place or a space where the women can encounter and support each other or where they feel safe. And they do consider that it is important to attend or to go to doctor's appointment, but they have several constraints such as time, money, and distance, which doesn't allow them to go to all of that checkups. So our recommendations and next steps for this project are mainly three. The first one is that we need more data. So we have also designed a survey that can be administered in partnership with the municipality to gather more information from a broader sample of women. And once that we have more information from more women, we recommend to include sexual and reproductive health trainings in the community building workshops for these women. And finally, it is also very important to open and to create the safe spaces for these women to encounter and to support each other. So thank you very much for your time.